You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
Weird Medicine contains mature content and may be offensive to some listeners. That young man says naughty words.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve! Yo, take a cowboy. Do the vertebrae. I need some suction. And the carotid. I bring the crash car.
From the pork snouts are actually considered a legitimate food choice, capital of the world. It's Weird Medicine, the first and still only uncensored medical show in the history of radio. Now a podcast. I'm Dr. Steve with my little pal P.A. John. Hello, John.
Hey, Steve.
I have with me in the studio Dr. K, the lovely and talented chiropractress.
Hello, everyone.
And we also have double vasectomy Todd, also known as addictomy Todd, a.k.a. Fecalicious, the man with inadvertent multiple penis tattoos on his arm.
Howdy.
And in the studio audience, we have Ashley, the girl whose name is Ashley.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have questions you're embarrassed to take to your regular medical provider, or if you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347...
Fart box.
No. And he was nodding when he did that. Like, I said something good, Daddy.
He did.
347-Pooh-Head.
Pooh-Head.
If you're listening to us live, the number is 754-227-3647. That's 754.
22 penis.
Very good. Or 754-Bear-Nip, which is my favorite. Or follow our Twitter feed at Weird Medicine. Visit our website at weirdmedicine.com for podcast, medical news, and stuff you can buy, or go to cafepress.com/weirdmedicine for stupid merchandise. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician's assistant, barber, chiropractor, cosmetologist, yoga master, or whatever. So, all right. We have got some awesome stuff to play, and we've got a bunch of great phone calls to take. But before we do, I want to, number one, thank everyone who has gone to Amazon.com and bookmarked the link that they can find at riotcast.com/weirdmedicine and use that link to buy stuff at Amazon. You know you're going to go there and buy stuff. Who does?
You're listening to Weird Medicine with Dr. Steve on
Whose name is Ashley. Stupid merchandise. Most importantly, we are not your medical providers. Take everything, apparel, groceries. What did I buy for Tasty incentive for Weird Medicine listeners to try Gamefly.com for a free one place to the other, and it has to hold up, but it is little like globby white balls with little tails. So
Interesting.
Okay.
But anyway, that's on there.
Well, now I know I'm going.
If you want to play with your goo, go to Gamefly.com/fluid and give it a try. And I'm not even kidding. It is. Gamefly.com/fluid will get you the $22.95 free value. So,
Nice.
Anyway, so there you go. Advertisements aside, a couple of things. Okay. A little while ago, it was Sam Roberts' birthday. And so I called him and left a voicemail message. Also, by the way, I sent him a birthday present. Mm-hmm. But I called up, and I was just going to goof on him, not really remembering who I was calling because, Sam lives his life on the radio. And so my voicemail ended up on there. And I would have done this a little differently than he did. I would have played it and said, see if you can figure out who this is.
It ended up on the shit show?
On the shit show, yes.
Okay.
Yes.
That's actually the second most disturbing birthday message I got. You all know Dr. Steve. He does the Weird Medicine show on the weekends. He's a legitimate doctor. Like
Well, I don't know about that, but don't get excited. There is a reason why I'm playing this, by the way. We'll play this again on the Sirius XM show, but there's a reason, because something I'm going to play later kind of hinges on this. And you'll see when we get there.
That's actually the second most disturbing birthday message I got. You all know Dr. Steve. He does the Weird Medicine show on the weekends. He's a legitimate doctor. Like that's how he became Dr. Steve. He went to medical school and he became a doctor, and then he started using his first name instead of his last name, so he wasn't so identifiable. But he helps people. Like, people go see him and he helps them. This is a professional doctor, and he gave me a nice birthday gift. Ooh. And so I was going to call him, and then I fell asleep. And then when I woke up to call him, I noticed I had a voicemail from Dr. Steve. And the first thing I thought was, oh man, like, now it seems like I'm just calling him because he called me and he left me this voicemail. Well, let me listen to the voicemail. I didn't realize when Dr. Steve has a bad day, he starts doing characters. Did any of you know this about Dr. Steve? Like,
yeah.
You didn't know this either, Eric.
No.
And you have a pretty close relationship with the guy.
I talk to him like a couple times a week, and I've never heard him do a character.
When you go to doctors and they tell you if you're, like, gonna live or die type of doctor, do you expect that they're the type of doctor that drinks and calls people up with characters out of nowhere on their voicemails? No, I wouldn't think so. Listen to the voicemail that Dr. Steve left for me, and you tell me if this was a guy that you would entrust.
Now, all of you in this room know exactly what you're going to hear next.
That's right.
Of course. And we'll talk a little bit about
your life, too.
Well, I was going to call you and wish you a happy birthday.
There's no setup. There's no name to the character. This is just what the voicemail is. This was what was left on my phone.
And I hope you have you good. Well, all right. Well, I hope you don't eat too much cake and get a high blood sugar, because you know what that can do to you. It can do some pretty bad things. Oh, Lord, I know it.
I'm just listening to this, and I'm going, wait, what? And then I look down at the phone. There's still 50 seconds left of his voicemail. I don't know what he's doing. Eric, have you heard anything like this from him?
I try to run it out.
Was he drinking?
No, it was 4 o'clock in the afternoon. He was at work.
Doesn't mean anything.
I guess.
My sugar's so high, I have to take me some insulin. Well, Mary, all the time, Mary always tell me, Hermeline, check your blood sugar. And I'm like, well, all right, I will. And then I check it, and it's always high. And they tell me, well, Hermeline, if you don't stop eating cake, you're going.
He's still talking about cake and blood sugar. I mean, do you understand the insanity? Like, I felt like I was in... I didn't know where I was anymore because I just woken up.
I mean, you guys have all gotten that phone call from me multiple times. It's just funny hearing somebody
who'd never heard it before.
Never heard it before.
I get it. And now go.
I've even called this show with it. As a matter of fact, I've got other friends who now call me, and this one lawyer friend of mine, when I see his number on there, I know what I'm going to hear because I'll answer the phone and I just hear, well, that's how it starts. Yeah. And then we drive our wives crazy because when we get together, we talk like that. Well, we got another guy doing it. I've got 2 friends in Winston-Salem that now call each other doing this stupid voice.
That's a great one to do.
And it's so stupid. Yeah. But it all, I'll tell you the truth, it all started when I was in college. And this is just what, they're talking about, well, I've never heard Dr. Steve do a character. It's because, I don't know why I don't. It's just that's a different world up there, and I can't make any tread, get anywhere with them doing characters, my stupid dumbass characters. But I used to call this radio talk show when I was in college and use that voice. Yeah. And we had this friend of mine. We had a band, Mando Birch. You're familiar with that. Mm-hmm. And we did one of our few paying gigs was a pool party, and we passed the hat and we got $20. Right.
Nice.
So we went to this guy's house and it's like we're going to party. And this friend of mine's little brother's name was Mike, and we gave him the money. the $20, and said, go get us some food and stuff to drink, right? And it was like he was our roadie or something. We were cool. And so we were hanging around waiting for him to come. Well, he shows up, and he's too young to buy beer. So he shows up with like 6 bags of taco chips. And he spent all our money on nothing but taco chips. He's got he's got his arms just full with these big bags of taco chips, right? So is a 20 a sawbuck?
Yeah.
Okay, so we started calling him Old Sawbuck. Here comes Old Sawbuck. And I would call this radio show that knew nothing about any of this.
Yeah.
You know, it was just to them. It was just totally random. I'd start going, well, I wanted to tell you the story about Old Sawbuck. We was back in the Depression, and we didn't have nothing to eat, and he brought us a bunch of tacos. And then I'd start singing, well, he was Sawbuck, and he bought us some tacos. And I would do that until they would finally hang up on me.
How long did that take?
Oh, I would just about get to, and he bought us some tacos, and click. So anyway, so that's, so I'm 56 now. That was almost 40 years ago that I've been doing this.
And now you have your own show, and you can sing for as long as you want.
Right. They can click me off. I just won't know about it.
And I'm like, oh, a voicemail from Dr. Steve. And this is all I hear. I'm going, this does not sound like Dr. Steve. He's just talking about birthday cake and insulin. I mean, I guess that's medical stuff, but he's just going on and on about eating too much cake. Is this the character that has
trying to
diabetes?
Be weird for the sake of being weird?
I don't know, and it wasn't even for broadcast. It was for my voicemail.
Yeah, but
anyway, it goes on and on. But that was the little. But later in the show, I'm going to play a bit of audio for you called Big Joe's Monthly Visit.
All right,
it's a brand new one,
my
and something in this will figure back into that. But I just wanted to give everybody background so when they heard it, they'd know what it was. So anyway, all right, looks like we've got a few phone calls. I'm going to tell you guys a couple of things before we get going. Check out riotcast.com, and there is a Riotcast app coming out, and it has been submitted to the Apple Store, so by the time you hear this, it may be available. You'll be able to listen to all the podcasts on the network. You'll be able to look at all our Instagram and our all our tweets and stuff. And when we're live, it will alert you that this show is going live right now, and then you can go and just listen to the show live.
That's awesome.
It's going to be really cool.
But it's not going to alert the people that are actually doing the show that they are live.
Right.
That'd be awesome.
What P.A. John is referring to is before we got started, I had a microphone open, and he and Dr. K were in here bad-mouthing people live. Fortunately, to only 2 people who don't know you. So, the other thing I wanted to tell you about is coming very soon to an Apple App Store near you is the Weird Medicine app, and I wanted to show you guys the prototype for it. I've got my iPad here. And,
which is pink, everyone.
Well, this is my wife's.
Sure.
Thank you. All right.
It's okay.
All right.
Now
Thanks for blowing that for me. But here's the front page of the app. Now, all these little X's will actually have things on them. And so it's like if you're a fan of Big Joe, you can play her theme song. Let me see if I can get it to play. Well, shit.
That's working wonderfully.
Oh, there we go. So you can do that. Let's see what else we can do. We can. Oops. Oh shit. There's a whole.
And again.
This is an awesome.
This is actually a viral app.
Yeah.
There's a whole Mando Birch section with Mando Birch music.
Oh. Great.
And shut up, John. It's got caricatures of all of us with soundboards and stuff.
Okay, I want to see my caricature.
That's awesome.
Yeah, they're working on that one. They actually do have
I'm like,
one
I
of
don't
you.
see me.
Let's see here. And then just, it's a soundboard. So let's see here. From the South, meat and liver mush is part of a healthy breakfast. And it will have a BMI calculator that will say if you're a fat shit or if you need to get off your ass and get some exercise and stuff like
Nice.
that.
You going to put the stool scale on there?
Yeah, the Bristol. Yeah, oh, yes. Let me show you this.
Can you poop on your laptop and it'll tell you?
Yes. Yeah, here it is. Here's the Bristol stool scale. And
I keep hearing something.
I know, it's still going. But when you push on...
Oh, nice.
Like when you push on the different stools, it will give you the sound that goes along with it.
So, perfect. So sounded about like a 3.
It's done by Matt Bishop, and he did Jim Norton's iPhone app.
It's not going to stay there. Just set it up on the table there.
Set it on the table.
Yeah.
All right, let's take a couple phone calls.
I think they're still there.
Yeah.
They're scared now.
Yeah. Dave from Florida, you're on Weird Medicine. What's up, dude?
Hi, Dr. Steve.
Hello, Matt.
I emailed you this morning, and I want to thank you for getting back to me in such a prompt manner.
Yeah, sure.
Literally minutes. And I had asked you about a general practitioner doctor prescribing me Klonopin, which I had been prescribed 3 years ago.
Okay.
And you wrote me back, and you said that it works more. It works better when it's with an antidepressant.
Well, it depends on what you're treating. Let's forget about the email for a second. Just tell everybody why they originally put you on the Klonopin. Which Klonopin for everybody is clonazepam. It is related to Valium and Xanax and Ativan, that kind of stuff. So originally, a couple of years ago, you went in and something was going on. They gave you Klonopin.
Right. It's because I finally recognized, I guess, a little bit myself that I have kind of what I consider an anxiety issue.
Mm-hmm.
I don't have it near as bad as some people, I don't think, where I don't think I've ever had a blown-on panic attack, but in some situations my heart races and I sweat, and it's
We're just waiting for Dr. Scott, everybody. We'll be getting started in a couple of minutes.
a normal person should, and I recognize that.
And how often were you taking the... I'm sorry. How often were you taking the Klonopin?
Well, I only took one cycle of it, and then for reasons that I don't have a good excuse, I never bothered to go take it again.
Okay.
Some of it had to do with me losing my job, and there was just lots of things going on, and I never went back. But that's not true. I actually went back and got a prescription, but I never had it filled.
Okay.
So it's been 3 years, and now I'm trying to deal with this, and because I recognize it's an issue. But I wanted to tell you because he also prescribed me other things at the same time.
Okay.
And I wanted to talk to you about those.
Well, sure. Well, briefly. I mean, some of the detailed stuff we can do by email, which is fine. And anybody that has a question can email me at weirdmedicine@riotcast.com. But just briefly list them off. Give us the Reader's Digest version, and we can get to your to the main question.
Okay. Yeah, no problem. I'm sorry. I didn't want to. No. I thought I was bothering you by emailing you.
No, dude.
The antidepressant was Prestique, and I don't like taking it because it makes me feel like a completely weird person. I don't know. It doesn't. I don't like it.
Yeah.
Like right when I take it, an hour after I take it, I feel it.
Mm-hmm.
And I don't like it.
Okay. Fair enough.
And then the other thing that he prescribed me, which I looked up later and it completely shocked me, was he prescribed me Zyprexa.
Right. Which it shocked you because when you read it, it says it's an antipsychotic, but really a lot of people will use it for anxiety as well. It's now, here's the thing. If you have anxiety every once in a while in certain circumstances and the rest of the time you're okay, like people who have stage fright or societal anxiety disorder, whatever, or social anxiety disorder. Where
that's what I would guess I have.
Okay. If it's very few times in the month, let's say 2 or 3 times in a month, taking an as-needed medication like Klonopin is probably okay. You take it, you get through whatever it is, and then you don't need it again for another week or 2. And that's fine. Now, if you find that you're having to take it every day, that's when you run into the situation that these medications are habit-forming. And not only are they habit forming, but if you stop them suddenly, the withdrawal syndrome is very dangerous. So doctors, for the most part, would rather treat you with an antidepressant of some sort because they work really well for anxiety and they're not addictive and they don't have as bad of a withdrawal syndrome. Although they do have a withdrawal syndrome. I was on Cymbalta and I quit it for the same reason you quit the Prestige. I felt like a weirdo on it. And when I quit it for 2 weeks, I had Terminator eyeballs. And Todd, double vasectomy Todd, who's the nerd in the room, boy, he perked up when I said that. Yeah. What it was I felt, I could feel like electronics behind my eyeballs, and when my eyeballs would move, they would make the sound like a Terminator eyeball would make when it's moving. It sounded like there were servos behind my eyeballs. It was ridiculous.
Wow.
And it went on for, just like that. Went on for 2 weeks, so I totally understand your reticence of getting back on an antidepressant.
I'm starting that tomorrow.
Yeah, some people start taking drugs to feel like that.
Yeah.
It was really
that
a
would
creepy
be
feeling.
awesome.
I like it.
I'll totally try that.
Did you shoot anything out of your eyes?
But no. But the main question that as I recall that you had was, can a general practitioner or a family practitioner write this stuff? And absolutely they can. 70% of all psychiatry is practiced in general practice or family practice or general internal medicine offices. Only about 30% of people who are being treated for psychiatric illnesses are being treated by a psychiatrist. So that's a great place to start.
Okay, because that was my thing. It's like I don't feel like that I'm a super depressed person that needs to go see a psychiatrist and all of that. But then I read these, I read about Zyprexa, and it's like, wow, am I that bad? My goodness.
Yeah.
And the Klonopin is only a 1 milligram prescription, so I was, that's why I asked you about the general practitioner. Like,
sure.
Can I get on that and maybe, have a little less social anxiety, with the just getting nervous around being other people, It's that kind of thing. I'm just like almost like extreme shyness to a fault,
Yeah, there's no pill that will fix that. The other thing that I would recommend for anybody that has an anxiety disorder that requires them to take medication is to get counseling from a cognitive therapist. They are psychologists, they're PhD psychologists, and there are some licensed social workers as well that practice cognitive therapy, but they work on internal and external behaviors. And the great thing about cognitive therapy is it doesn't take 2 years. Most of the time they can fix you up in 6 weeks. So it may take 12 visits, something like that, twice a week for 6 weeks. So I definitely think that you need talk therapy, and then go talk to your general practitioner and talk to them about maybe getting you back on some medicine if it's affecting your lifestyle. Ashley's got a question.
I take it, I've been prescribed Klonopin and Prozac and a couple other things for anxiety and depression just recently, the past couple of weeks. And I've been taking about 3 milligrams of Klonopin a day, and sometimes it makes me feel like an absolute zombie. And do you know if there's an alternative that is faster acting? Because when I take it, I want immediate relief. I want the anxiety gone now. But then it takes an hour for it to kick in, and then I'm like, bleh.
And Klonopin has a long half-life, which also means that it takes a long time for it to get pumped up in your system as well. And so it has a delayed onset.
So take it with a beer?
That's why a lot of doctors like it, because they feel that because you don't get that peak, that it's less likely for someone to get habituated to it. Now, Xanax works really fast, but it is way habit forming.
Yeah.
And so, for you, I would consider, and this for, is it David? All right. The long shot camera looks like the space shot. Back in when Ed White was doing the spacewalk, and they would do one frame every 7 seconds. That's what it looks like, and I don't know why. It's the same camera as all the other ones. That one's good. This one, hello. That one's good. Both of those are good, but then that one is messed up. So let me see if I can fix that.
Can you zoom in or zoom out or?
Single camera. Weird Medicine Live. Well, I don't know, so I'm going to find out. I'm going to take that one off of there. Let me reinstall it. No, that's weird. Okay, use buffering maybe? Now move around. That's worse. Use preset. Nope. Use preset. Let me see how the other two cameras are set up. That's just weird. Doesn't even fit the friggin' frame now. Oh, there we go. And I got a big rumbling from somewhere. Hang on. That's your microphone. Why is it rumbling? It's shaking around a little bit.
Mm-hmm.
Your mic. Nope.
I don't hear anything, Dr. Steve. I hear nothing. I hear that.
Yeah. I don't like that. There we go. Loose connection. Talk now.
Test.
Oh,
test,
yeah.
test,
It's
test.
1,000 times better. Okay. Let me just check one other thing here. I just want to see what my... Nope, it's doing it again. I may have to put a new cable on that. Use preset. Well, I don't know the answer to that. I just won't use the long shot very often, but that pisses me off. You see that?
Hey, who we got? Not Cupcakes. What's up, Not Cupcakes?
Okay, I'm just going to have to deal with that. But people listening with headphones are going to have a problem with it. And I do not understand what's wrong with that camera. I'm going to have to uninstall it and reinstall it, but we'll do that some other time. All right. There you go. You ready?
Oh, yeah.
Let's do it. Carson?
Fantastic.
What do you want to be on the show? Just
What's that? Yeah, that's fine.
Carson? Okay.
CB.
Ooh, I like that.
CB Radio.
CB.
All right.
I don't know if
Here we go.
do that or not, but who cares?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out, blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical provider who gives me street cred the Wacko Alternative Medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
Also in the studio, we have Carson.
Hello there.
Carson's a medical student. He's going to be hanging out, see if he really wants to do that or not. This is a show for people who would never listen to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347
Who-head.
Visit our website at drsteve.com for podcast, medical news, and stuff you can buy I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Very good. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And we've got Carson here in the studio. He is a pre-med, so we've descended from having MDs, PAs, DOMs to having residents in here, and then we had some medical students. Now we got a friggin' pre-med.
A couple nurse practitioners mixed in there.
Yeah, of course.
All the way down the chain.
Couple biologists and zoologists.
Yeah, so we've descended through the food chain. That's exactly what it is. Exactly
lower. We're at the bottom of the barrel.
Why in the hell do you want to go to medical school? I just, would I do it again? Yes, I would, but I was called to do it. So that better be your answer, or I'm going to try to talk you out of it.
That's a good answer. That's a good question, actually. It all started in high school. Kind of fell in love with science. I wanted to do something in that realm.
Yeah.
Then I went to healthcare, and I thought I wanted to be a nurse. And then I said, screw that. I wanted to be...
I was going to use the old 1980s joke, but you realized you weren't gay, but that's not true anymore.
Shit.
What never was true. But that was
Dr. Steve, guys.
That was the
Dr.
joke
Scott.
Back in the 80s. And I'm saying I'm not going to say that joke. There's so many men in nursing now.
Right.
I mean, way more than there ever was. I go through the ICU, and it's all dudes now.
Oh, really?
Well, not all, but I mean, there's in one of our ICUs is a preponderance of dudes. So, and I think it's a good thing. I really do, actually.
The funny thing is, if I did go into nursing, I actually kind of want to be a midwife. So, kind of glad
that
didn't fall onto me.
Interesting. Why in the hell? Okay. Now
I think that would be interesting.
It is.
It is interesting.
Yeah.
I used to cry every time I delivered a baby, and until the last time I delivered one. And it was my very last delivery. Now, this kid is 30 years old now, and so this is not personally identifiable story because nobody will remember this story. But basically, I got the head out and I couldn't get the shoulder out, and that's called a shoulder dystocia. And there's a lot of different maneuvers that you can do, but the first maneuver is to just take the head and put downward pressure on it. You're trying to get that lower shoulder to just kind of move out of the way so the upper shoulder will pop out, right? So I did that. And I hear this crack, and I'm like, oh, and I hear, this in my head, and then I'm thinking, and the kid just came blooping out at that point, right?
Right.
And so I said, check this kid. You hand him off because you got to pay attention to the mom in case she's bleeding. Hopefully she's breathing after that. And so I handed the baby off to the pediatric staff, and I said, check this baby out. I mean, everybody in the room heard that. And so I'm sewing up a tear and just sweating it. And I'm like, how's the baby doing? APGAR's 8 and 10, which is good. And they checked the baby out and said, there's nothing wrong with this kid. And I'm like, okay, well, so I heard something. And so I check around on the mom. Do you hurt here? Do you hurt there? And she's like, no, I feel fine. And I went, okay. And I never delivered another baby because what I realized was that it's either you're crying because it's such a joyous thing or you're shitting your pants because it is a nightmare. And it's either, it's either loads of fun or it's just a complete stressful, nightmarish situation. I used nightmare twice, but I couldn't think of a better word. But anyway, so yeah. So midwifery. Did you ever do that?
No. But I mean, who hasn't watched those? Those birthing videos on YouTube.
Oh, really?
Yeah, it's
okay.
very
I've never watched one.
Oh, really?
No, I have
That's
no
surprising.
interest.
Well,
I've seen it.
Well, I would say so. But for someone who
Yeah.
is not able to have that opportunity,
and you watched that and you said, I want to do that.
Well, I think it'd be fun to participate in the process.
Yeah,
I don't know if I could be an OBGYN. I don't think I could do that. But I think it'd be fun to be a part of the process. I don't know if I could be the leader in the room, however.
Yeah. I was a really good stage 2 coach.
Oh.
Take a deep breath, hold it, push. I enjoyed that.
Yeah, that would be fun.
Yeah, it was fun. And then I got to use my training with my wife when she was pregnant, and that was cool.
Okay.
No, I'm not shitting on you for it. As a matter of fact, I admire it. That any how old are you?
21.
21-year-old that would look at YouTube videos of people having babies and say, I want to be part of that. Right. I think that's awesome.
Yeah, just like surgery videos. It's something.
Yeah.
Just part of life.
So, but you don't want to do OBGYN.
Yeah, I don't. I think.
But you're going to do family medicine, so you're going to be delivering some babies.
Oh yeah.
Oh yeah. Were you not aware of that?
Well, now I am.
Yeah, that's your first year will be internal medicine, pediatrics, OB, and surgery. Right. Yeah. And then family medicine. Like a lot of the places don't do internal medicine anymore. You just do family medicine service. But and then you'll have to do a second. Dr. Scott, if you would,
sure, look
up rotation requirements for family medicine residents, and you have to do a second year rotation in OB as well, I think. And we at the time, this was back in the 80s. Covered the labor and delivery when we were on call for family medicine. Most of them around here don't do that anymore, and I can't say most of them other places. So if you're really not interested in doing that, you want to, when you start looking at programs, say how heavy is your OB requirement and how many deliveries do you get to do. Mm-hmm. And if they say, well, we do 1 or 2, then that might be for you. You have to do a certain number for them to be certified. Okay. And does it say, Dr. Scott?
I'm waiting for it to come up. I was also looking at a couple of things.
Well, anyway, all right. But, so, welcome to the studio.
I appreciate it.
If you got something, pipe up. You can be the lay person for today. Well, the sort of enlightened lay person.
Oh, okay. That sounds
fun. All right. And, Scott, are you monitoring the feed? I just want to make sure that the audio is okay.
Yeah, they say we sound good.
Okay.
Yeah, so it looks like family medicine or emergency medicine, internal medicine, psych, preventative medicine, and if you're good at DO school, neuromuscular medicine.
Okay.
And you can specialize in addiction.
Yeah. But that's what I'm asking is, what are the required rotations for ACGME certification? And because you want to go to a certified program.
Oh, yes, you can.
And the worst thing, well, it's not the worst thing that could happen to you. There's lots worse things, but to be in a residency program that loses their certification in the middle of your residency, that sucks. So anyway,
and, I originally wanted to do emergency medicine, but it looks like they're graduating so many emergency medicine residents that a lot of people graduating from residency can't find jobs.
Really?
Yeah, they've been graduating so many EM residents.
Is that right?
And it's
what do you want?
They'll be able to find jobs, but they don't. Not in like desirable locations.
Right. Do you want me to tell you one that is in high demand and will be for the next at least 20 to 30 years?
Psychiatry?
Yes, that's one. I'll give you this.
Give yourself a bill.
Palliative medicine.
True.
Huge shortage because there aren't enough fellowship programs, and they are only most of those fellowship programs only graduating 1 or 2 fellows a year. So there's, health systems are realizing, hey, we have to have palliative medicine. For people who don't know what palliative medicine is, it deals with symptom management and medical decision making in people with advanced illnesses. It's not end of life. I mean, that's part of it.
Right.
And it isn't an easy field to do. You got to be called to do that too. You got to really want to do it. But huge shortage to the point that we have 4 physicians in our program, and 2 of them are not board certified.
Wow.
They just have the heart for it. Because if you wait around to get a board-certified person, you're going to be waiting for a long time. So board-certified people are in demand, and the only way you can get board-certified is to do a fellowship.
Yeah, and I'd say I'm sure it's a bigger problem even in the rural areas.
Yeah, it is. So if you have some interest in doing that, and we'll get off this topic because now we're getting way too into the weeds. I'm sure I'm boring the shit out of people, but if you go to
God damn, this is about as
all right. Anyway, we'll talk about it later. All right, Dr. Scott, I just had one story I wanted to do, and we've got 1 million phone calls to do today.
Okay.
And this is the big one. We are recording this at 3:53 on Wednesday, December 22nd, and about 3 hours ago, the FDA cleared the Pfizer drug for high-risk patients 12 and older.
Cool.
This is Paxlovid. And we knew Pfizer had a drug that was kind of under the radar. We were focusing on molnupiravir, which at first looked great, and its luster has decreased a bit. It prevented hospitalization by about 30%. But the Paxlovid by Pfizer is about 90% effective in preventing hospitalization, and even more so for death. And they feel that it's likely to work against the Omicron variant as well, although we don't have a whole lot of data yet on that. But you want to take it as soon as you start feeling sick. And so this is that scenario we've been talking about, where you get sick, you go to your doctor, they write you a prescription, you go fill it, and you go to the pharmacy, fill it, isolate for your 10 days, take this pill, and you don't go to the hospital and you don't die. And if Omicron is less lethal and more contagious, it will take over, and so lethality will decrease. And then we have this pill for people who are at risk of progressing to severe disease. We also have early IV remdesivir. Mm-hmm. And we have the old monoclonal antibodies, which sounds funny to say that, old ones like Regencov, are no longer very effective against this variant. Okay. So if you're in an area with high Omicron penetrance, you're going to want to take one of the other IV monoclonal antibody preparations. And there's one of them out there, and I can't remember the name of it, but it's... It is still effective against the Omicron variant. So you just got to talk to your healthcare provider about that.
And hope they know the difference.
Yeah, hope. Yes. No.
Go in there as an educated person, people.
Yeah. No, absolutely right.
Yes.
Absolutely right.
Yeah.
Absolutely right. Well, you look that one up.
Yeah.
What's the monoclonal antibody that's effective against Omicron? Because I'm old, and my memory is not what it was, and I knew this like 5 minutes ago, and I can't remember the name of it. But anyway. All right. And besides that, IV stuff is hard to get. You got to get people in an infusion center to do it, even though the monoclonal antibodies can be given subcutaneously, but the IV remdesivir is... it still requires an infusion center, and so you have to have one that you can have ill patients that have a communicable disease. Whereas a pill, you give somebody a prescription, they go fill it and take it home and take it. So this is a big move forward.
So it's not over the counter?
No, it's not over the counter. But because if it were over the counter, there'd be a run on it. Everybody would just go buy it, and there wouldn't be any for the people who need it.
And then there'd be some asshole selling it for $1,000.
Well, maybe right after
if they buy them all at the CVS.
That's true. Yeah. That's true.
We sell them on the street corner.
Yeah, not that Stacy would do something like that.
Not that Stacy would do that. For $100, he'd be happy to.
Oh, he heard that you sigh when I mentioned his name last time, but I do want to play something.
Yes, I did.
I do want to. All right, I want to play something from him that is a very positive thing. And
Let's get this in
Dr.
here.
Steve and Scott. Just want to throw out a little thank you and appreciation to solid thing from Batco Foundation, where they received a whole lot of toys on the 11th, the 12th, and on the 13th. And that coincides with the last Weird Messin broadcast where you mentioned the Batco Foundation and their toy drive. And so just wanted to say thank you to the people who have donated and greatly appreciate it. Thank you.
Yeah, okay, cool.
Awesome.
Thanks. Yeah, that's awesome. We'll give ourselves a
good
job.
Good job, team.
And there's still time to do that. I mean, there's never a time when kids who are sick don't need things to entertain themselves. So just go to Batcole, BATCOLE .foundation, and you can donate there. It's really is a worthy, people, oh, it's a worthy cause. This one really is a worthy cause. All right. You got anything before we move on? Did you find that antibody?
Yes.
Okay, what is it?
All right.
Okay, here we go.
This is going to be good. Jesus. This is going to hurt.
Okay, another one for WATP Cringe of the Week.
Yes, yeah, Bamlanivab.
That one. Yeah. Yes, there you go.
Bamlanivab.
Give yourself a bill.
God damn. Can't they make it something like Joe's?
Joe's
treatment, yeah. Bamlanivab.
Spell it.
BAMLANIVIMAB. All I can think of is that old song, Bam, Wham, Wham.
Well, you can't even say that.
Goddamn hell.
Shamalama Ding
Shamalama
Dong.
Ding Dong. That's what I need a vacation, I think.
Bamlanivimab. Oh, Jesus, now I can't say it. Bamlanivimab.
Bamlanivimab. That sounds
there
right.
you go. Bamlanivimab. God, that is a mouthful.
It is a handful.
Yeah. Okay, well, that one is still good. So that's the one you want.
Yeah.
Bamlanivimab. That's what Bamlanivimab.
Yep.
Bamlanivimab. Okay, I got it that time. And it also looks like I'm not even going to try. It's ridiculous. That's why they have trade names for these things. Regencov.
Name it Joe's monoclonal antibody.
Big Joe's.
Hey, Jim's monoclonal antibody treatment.
There you go.
Yeah,
All right.
go.
Okay, all right. You want to answer some questions?
Let's do
Number one thing, don't take advice from some asshole on the radio.
All right. Let's do this one.
Hey, Dr. Steve. This is so-and-so from so-and-so.
Okay, well, very good. Nice to meet you.
So myself, my aunt, and my mother were in the waiting room. My dad's in the ICU at a hospital here in so-and-so. And a man walks out of the ICU area and comes and sits with his family. And this is what he said, and I quote, "Well, the penis has retracted into the scrotal sac, and they're afraid the head of the penis is going to fall off." What the fuck happened to this man?
I don't know, dude.
Sounds like
what the fuck happened to this man? That's it. Just
Well,
curious, like,
that's
what could have happened to make your penis retract into your scrotal sac, and then the doctors in the ICU are worried about the head of your penis falling off?
Oh, that's the clue.
I've got this
in
one.
the ICU.
I've got this one.
Do you? Okay, yeah, go.
Shrinkage.
It's the shrinkage.
It's the shrinkage.
I need to have that as a draw.
Everybody knows what shrinkage is, right? You know what shrinkage is.
Of course.
Yeah.
Yeah, cremaster reflex. Poor old George Costanza. And who hasn't had that experience?
Shrinkage.
You're standing there and naked, and some woman who you want to have intercourse with walks in, and you just got out of the pool or out of the ocean, and she looks at your junk and starts laughing. Wait, you guys haven't had this? So anyway, so and then you have to yell, "It's the shrinkage, as she walks off, never to have sex with you ever.
I love it.
So yeah, this guy, the answer is he's in the ICU. So this person probably has a catheter, and he probably has edema or swelling of the junkal region, which can happen under several circumstances. There's an instance called anasarca. Anasarca is just total body fluid, and you can get fluid in and around the tissues of the scrotum. It's not like you're just dumping fluid into the scrotum, but the whole thing has become massively, the tissues are engorged with fluid. And when that happens, the penis can retract into the body. And if let's just say that someone didn't notice that and I'm assuming this person has a foreskin, the foreskin was retracted when they put the Foley catheter in, then the head of the penis can just slough off.
It just literally gets choked
you
off.
You get nothing. You lose. Good day.
So, that's one of those. You get nothing, you lose. Good day, sir episodes.
Yep.
That's a possibility. When that happens, it's called balanoposthitis.
Oh, God.
You know what that is?
My favorite thing, balanitis.
No, not balanitis. This is a worse one.
Oh, no.
Balanoposthitis.
Oh, Lord.
And balanoposthitis is when you have inflammation of the head of the penis and the foreskin. And that can happen under trauma, any kind of infection, foreign chemicals that get caught between the foreskin and the head of the penis. Any of these things can cause this. But the only thing I've ever seen that caused the head of the penis to slough off is when there's constriction. And you can get the constriction when the foreskin has been retracted and then nobody notices it. So we're giving a moment of silence
poor
for
guy.
this person's penis. Good Lord, can you imagine?
No.
I love how this guy was getting more and more agitated. What could cause that? What could cause someone to come out and say that?
Yes, because he doesn't want what this dude had.
No,
Yes.
you won't.
No.
You won't. That's extremely unusual. I've only seen one penis head slough off. And it was due to a retracted foreskin that was forgotten about.
Yeah. They could have something similar if they forget a rubber band or kind of
don't put a rubber
ring,
band around your penis. Matter of fact,
you could do something very similar.
We teach our residents and medical students if you're going to use a rubber band as a tourniquet, don't ever just wrap it around that body part. What you want to do is stretch it around the body part, end to end, and then clamp it with a clamp.
That makes sense.
That way, you can't forget that. If you're doing a toenail removal and you want to use a rubber band as a tourniquet, if you wrap it around the toe, there's a non-zero chance that you'll forget to take it off and the person will put their sock on, and when they get home they'll have a dead toe and it will eventually fall off. Whereas there's no way in hell that they'll pull on their sock when they've got a clamp on there. And when we're talking about a clamp, for people out there that haven't seen a medical clamp, it looks like a pair of scissors, except it's clamped. It's got a ratcheted lever on it that will, the tighter you push the two scissor handles together, the tighter this clamp will clamp, and it'll hold it.
Yeah.
And so you just bring your rubber band up, and the two ends, and then you do go click, 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 and you clamp this thing on there, and then it's impossible for you to forget that. And if you're going to clamp off a penis for whatever reason, I can't imagine why you would do this, then you would want to do that the same way so that you don't forget.
Yeah.
Don't ever wrap a rubber band around your finger, your toe, your
even
penis.
Wrist,
there's a non-zero chance that you'll or your wrist.
Yep.
There's a non-zero chance you'll fall asleep, because when are you going to do that? You're going to do stupid shit like that when you're drinking, and then you pass out, and then you wake up.
How long do you think that would take if you put a rubber band around?
I don't know. An appendage can last for hours. When they do surgery on the arm, like hand surgery, they'll put a tourniquet on it, and it'll be bloodless for an hour or two. And, you can do it, and then you just take the tourniquet off. The first person that did that had to be a ballsy son of a bitch. To just rob a limb of blood supply and think that when I undo this tourniquet, it's going to be okay. And it must have been a military thing where they realized when they put tourniquets on people's limbs and took them off in surgery that that the limb became viable again. So our limbs can deal with it, but appendages not so much. You know?
Sense.
Yeah. So anyway, all right.
We're off to a rousing
Dr.
start.
Steve, it's Mike from New York calling.
Hey, Mike.
I'm doing well, thanks.
Oh,
Glad
okay.
you guys are too.
Oh, I believe that one.
Dr. Steve, it's Mike from New York calling.
Hey, Mike, how are you?
I'm doing well, thanks.
There you go.
Glad you guys are too.
Yes, we're great.
I stubbed my toe a few weeks ago, probably about 8 weeks ago, probably about 2 months ago by now. And instead of turning black and blue, it got like a white calcium deposit on top of the nail.
Yeah.
Doesn't hurt, no issues with it. But if I have to look at this for the next 7-8 months while it grows out, I figured I'd find out what the hell it is and if there's something I should be concerned about.
Yep.
Again, it's like a...
Thanks, Mike. Do you know the name of this, Dr. Scott? I'll give you $20 right here if you know the name of it.
No.
It's okay if you don't.
No.
And I know Carson.
I was searching for it.
It's called Leukonychia punctata.
Nope.
And so leuco means white, onychia means nail, so white nail, and punctata means point, punctate. And this is also known as true leukonychia. This is the most common form, and there's small white spots appear on the nails, and this can happen when you bite your nails or pick at them, or if you have some trauma. So for whatever reason, trauma causes the nail that's normally relatively translucent to just become opaque, and when that happens, you see white spots. When you see them on 1 or 2 toes, it's no big deal. Its most common cause is injury to the base or the nail itself, and those white spots will disappear around 8 months. That's how long it takes. I remember one time, this was the dumbest effing thing I've ever done in my life. I was trying to take a sledgehammer to a Christmas tree base because I couldn't get the thing to go on the tree. The tree was a little bit too big.
Oh no!
So I took a sledgehammer to it. When I did, it slipped and my thumbnail hit the base of the base.
Oh, crapola.
It's so hard because I had all that momentum going because of the sledgehammer. And how did I do that? I don't know. It was a real short sledgehammer. It was more like a mallet, I guess.
Yeah.
And it hurt like a son of a bitch, and I got blood under the fingernail. So then I had to go and heat up a paper clip till it was red hot and plunge it through my nail to release the blood under the nail, because otherwise the pressure is just intense at the pain. And it feels so good if you do it right. You can't let that red hot paper clip hit the nail bed underneath, or then it hurts like hell because now you've burned the nail bed. So you got to do it just right. Should be done by a medical professional. Don't do this yourself. The other thing that we'll do sometimes if we don't have a red hot paper clip handy is use an 18 gauge needle, which really has a knife edge on it, and you put it over it and then just spin it. And when you spin it over the area, it will cut in, it'll act like a drill and drill through the nail. And then when you just start to see blood coming out, you stop and then you can express it. And that hole in my nail was there for about almost just under a year. It was just right before Thanksgiving that next year that I finally clipped that thing off.
Ugh.
Yeah. So
dumbest thing.
Yeah.
Real quick, I'll make it quick.
Yeah, no, you don't have to make it quick. Hell, we got 20 minutes to kill.
And I just put it out there to our friends on YouTube. I was drilling a little piece of a wood to put on a wall, and it was just as small, like a 2-inch by 2-inch piece, and I couldn't get it to hold still. So I just thought it would be a great idea to just put it on my knee.
Oh.
And I had that darn drill like that.
I already know where this is going.
And that thing caught, it was zipped right in there, and it went about a 1/4 inch into just above my knee. I'm like, Son of a bitch. I think that's the dumbest thing I've ever done. I just sat there for a second thinking, what the hell did I just do?
Yeah.
Just flipped it around, reversed it out. Zip.
I am too smart.
Oh
I
my
am
God.
too smart. I am too smart.
What an
I am
idiot.
too smart. SMRT.
Yeah, that's us. That's for the
I
two
love
of
it.
us.
I love it.
Uh-oh. Gonna have to call her back.
The boss.
All right. Okie doke. Well, there you go. That's white spots on nails. Now, there are other white spots on nails. There is Leukonychia totalis. Can you think of what that might be, Carson?
I'm trying to think of that second word.
Totalis.
Ooh, I'm going to take a shot in the dark and say it's related to the toe.
I thought he was going to say it's related to Cialis. I'm thinking it's related to
Total. The
total.
word is total.
Makes sense.
Totalis.
In,
So it's
in totality.
It's white. Right. Exactly right. It's completely white, and that's usually a result of mechanical trauma. It can also be a clinical sign of low protein in the blood, which will be seen in people with a thing called nephrotic syndrome. It's people with kidney failure, and they're just peeing out protein just constantly. Yep. And there are some other things, too. There's a genetic condition that you can take a certain antibiotic can cause this called sulfonamides. Let's see. Then there is Leukonychia striata. You want to take a shot at that one,
Yeah, no
Carson?
chance.
Okay, striae or striations.
Streaks.
You know what a
Streaks.
striation means?
Okay.
It's
Streak
a
makes
line,
sense.
right? So that will be transverse leukonychia. Those are called Mies lines, and that's whitening or discoloration of the nail that run parallel to the lunula, which is the nail base. And that's usually caused by physical injury. Could be disruption of the nail matrix, which is the thing that makes the nail, the nail bed. And again, biting or tapping of the nails. But it can also be seen in lead poisoning. So,
Interesting.
Yeah. Why is that, though?
No, he's making all this shit up, Carson. Those things don't even exist. You made them up.
I believe it.
All right.
It's pretty cool. Pretty cool.
Look it out. Let's do this one.
Hi, Dr. Steve. This is Art from Pennsylvania.
Hey, Art.
I love your show, and I'm a long-term listener.
Thanks, man.
I'm a type 2 diabetic. Last time my blood was taken, my A1C was under control.
Okay.
The problem is that I'm losing weight like crazy. Within the past year, I went from 210 to 170. I eat junk food during the day and fattening desserts at night.
Okay.
My primary care physician says I'm doing okay, but I still think there's a problem.
You're doing okay.
Could you please give me some possible scenarios of what could be wrong? Thanks, Dr. Steve.
Well, I don't want to do that. What I do want to do is, God dang it. Hang on. I got to get this. Damn it. Okay, let me start that over again. Well, I don't want to do that because there's too many here. Dr. Scott, this guy's got had a 40-pound weight loss.
Yeah.
Now, when he says his blood sugars are under control, I wonder what he means.
Yeah. Is A1C and blood sugar both are under control?
Well, that's what he's saying. The A1C is quote-unquote under control. Yeah. Does that mean it's 6.7 or below? If it's not, if it's above that, some doctors have a really kind of wonky threshold for what they think is a normal.
Under control.
Yeah, quote-unquote under control. And if it's anything above that, if it's 7 or 8 even, which used to be our goal, you may be looking at just your peeing out your calories. So I would check your urine to see if there is sugar in your urine, and if you're having a lot of glycosuria, which is the term we use for that, then you may be just losing so many calories through your urine you can't keep them. But there's other things that need to be checked for sure. And the 40-pound weight loss, when you're not trying to lose weight, is not something to dick around with. So you need to get checked for a lot of things. So if I had you on the phone right now, I would ask you, are you having diarrhea? In which case I would think maybe celiac disease or some other inflammatory bowel disease.
Abdominal
like Crohn's
pains,
disease.
Yeah,
anything like that. But, hypercalcemia, adrenal insufficiency, that's called Addison's disease. Right. There's a test for that as well, and other things. So this needs to be checked. And if your primary care provider isn't taking it seriously, then I'd find another one. And then let us know what they find. The first thing I would check on you is your thyroid and a urine, and I would check a complete comprehensive metabolic panel, because if you have Addison's disease, then your potassium will be off, and other things like that. Okay, but get that checked.
Yeah, this needs to be followed up more thoroughly.
Yeah, absolutely. Both hyper and hypothyroidism can cause this, but more likely to be hyperthyroidism.
Yeah. And depending on what medications he's taking for his diabetes, those things may need to be altered.
Well, that's true. Now, there are some of these medications for diabetes that actually cause you to lose calories through urine.
Yeah, if they're not absorbing your nutrients.
Well, and they actually make you pee out glucose. That's one of the ways that it works. Those and those drugs are known to cause weight loss. There's a lot of weight loss a lot of diabetes drugs now that people are using for weight loss.
Yes, yeah. And a lot of those, well, not a lot of them, but I know, I've heard of being some side effects from those causing abdominal pains and things of that nature.
Yeah.
So.
Well, of course,
anyway,
you didn't say anything about abdominal pain, but semaglutide is one that's also known as Ozempic, and people do lose weight on those, and so maybe that's why your primary care is saying that.
Everything's under control.
But they say you should expect to lose 5% of your starting body weight with these medications, but he's lost significantly more. He's lost significantly more than 5%.
I've got a real quick one.
Yeah, go.
So Talk Like Hick to you. I asked for other people that thought it was a good idea to stand on a horse, on a horse's back to reach for something and fell off and broke both her wrists. All right, that's a good one.
I am too smart. I am too smart.
Yeah, I'm 66. And I'm starting to get to where I don't want to stand on a chair to change a light bulb overhead. But I used to stand on chairs that had wheels on them. I could just sort of balance. But now I'm getting a little bit, I'm becoming a doddering old fool is what I am. But I was never stupid enough to stand on a living thing to do something. So that's a pretty good one.
That's a good one.
I broke my ribs.
Shocker.
Can
you believe that damn horse moved when I stand on top of it?
She's a damn genius.
I love it.
All right.
Oh, my God.
Oh, here's one for Dr. Scott.
Uh-oh.
All right. It probably applies to Amy, too.
Hey, Dr. Steve, it's Mike in New York.
Same guy.
Fine. Thank you. Glad you are, too.
Okay, yeah, we're fine.
This is probably more for Dr. Scott, but I know you can at least assist. A friend of mine is in perimenopause, suffering aches and pain.
Okay, his audio is so terrible. I'm going to cut him loose. But what he's calling about is perimenopause. But the patient, his friend, doesn't want to take drugs. They don't want to take hormone
HRT,
replacement.
Right. No hormone replacement. Sure.
Yeah. So what do you recommend?
We've got a ton of things. We've got a whole bunch of different old Chinese herbal medicines for hot flashes, for perimenopausal aches and pains, et cetera, that are not hormone derivatives.
Okay.
And that work extremely well.
Well, like what?
Tien Min.
Oh
yeah.
It's not just
I'm
you.
gonna make it.
It's right. It's both of us.
Heavenly
today.
Emperor's formula is the one I use.
Heavenly Emperor's formula.
Stress Less from our favorite
Okay.
company is actually we use for it, and this is truth for hot flashes.
Because what does it have in it that works?
Well, one of the
and why
things it
does
has
work?
in it is mouli, which is oyster shell. It's a cooling mineral, and it has this thing called chaihu, which is an old Chinese herb that helps cool the liver blood. Works extremely well. It's not easily translated into Western terms, but we have great results.
Really?
Yes.
So,
Yes, sir.
so give this person an answer. They can't just go to
No,
CVS and buy
no.
Heavenly Emperor's.
Yeah, find someone board certified in Oriental medicine, Chinese medicine like me that actually knows the difference between all of these different conditions. Because just like in Western medicine, one type of hot flashes may be different in one person versus another one.
Yeah, that's true.
And different medications are different. You know, if they happen only while they sleep, or if it happens during the daytime, or sometimes people have them throughout the day. It's all there's
sorry.
a bunch. No, there's just a bunch of different scenarios.
Do you use black cohosh? Is there a Chinese version of that?
There is, yeah.
What is it?
It's,
you know?
I don't know the Chinese name for it, but we do use.
We don't know
well,
shit.
I can look it up.
No, I know. Neither one of us do. I'm just stumbling over.
I can tell it's time.
Antibody names.
It's fake. I do know though. We do use black cohosh quite a bit.
Okay.
But Dr. Steve, it's really important that make sure that the friend has been worked up appropriately and everything is normal in this person. And if so, then find someone that can actually prescribe a Chinese medicine for them that help them with their menopausal symptoms.
I think
it'll be perfect for your the husband or boyfriend.
Perfectly reasonable to do in this situation. I'm looking at the Women's Health Research Institute website from Northwestern University. And just looking at non-drug things, so no drugs at all, because we always want a damn pill. But there are other things that we can do, and more fruits and vegetables will tell you that for everything. Avoiding alcohol, I don't like that. Eliminating cigarettes, yes, I'll give you that. Exercise regularly, and stay sexually active. Completely agree with that. Well, and now to help with the hot flashes, limiting caffeine. And even limiting spicy foods, because you may get a mild hot flash when you eat spicy foods normally, but when you're perimenopausal or menopausal, it can be even worse. And then they sort of practical things, just wear layers that you can remove easily. You can just say, well, I'm just going to take my sweater jacket off, and nobody has to know you're having a hot flash. But people don't want to mask it. They want it to not happen.
Exactly. And I think a lot of folks get tired of waking up in the middle of the night and changing their sheets 2 and 3 times and changing their clothes because they sweated through it.
Agreed. So that's
so we can help you. Yeah.
Yep.
We can help you.
Okay. All righty. And then they're saying here cognitive behavioral therapy. Oh, I guess you're saying all perimenopausal women are crazy.
I've got someone I would love for someone to try and talk
through. That's your ex-wife.
Through her perimenopausal
cognitive. That has nothing to do with her being menopausal.
No.
Biofeedback might be something.
Yeah.
Y'all ever do any of that?
Yeah, some.
Do you?
Mm-hmm.
How does that work?
We use the those magic points or stress points that are associated with the ear.
Yeah.
Typically, it's the same thing they use in battlefield acupuncture. It's that protocol. And then we'll do that and kind of walk them through some situations, depending on what they want to talk about.
Okay.
So, yeah.
All right. Here's one from follow-up from last show. And can you bring up, do you still have that article about the 14-year-olds smoking in New Zealand? Do you have the ability to pull that
I
back
think
up?
I can find it, yes, sir.
Okay.
I think so, yes, sir.
It's Kevin from Chicago.
Hey, Kevin.
I listened to the episode the other day. Dr. Scott was giving a piss poor explanation of the New Zealand smoking law. Just wanted to call in and clarify. The way the law was written, anyone who's under the age of 14 in 2027 will never become legal to buy cigarettes because the law increases the age you need to be by a year every year from 2027 going forward. So someone who is under 14 in 2027 will never become of legal age to buy cigarettes, and it's their way to try to, over time, phase out cigarette purchases completely.
Yeah, thank you for clearing that up. We had several people call this guy says Dr. Scott's a moron. This one says,
Yeah.
you know. So anyway,
They're right.
Yeah,
They are right. Yeah,
that one was not interpreted properly.
And I'll be happy for them to exchange seats with me any time.
There you go.
They're welcome to
But
jump
yeah,
in.
so I think that's a pretty effective strategy if you say, look, we're going to pick one age, and when those people who are born this particular year, they will not be able to smoke at all in this country, and they'll have to card everybody. And if you were born a year earlier, you can buy smokes, but if you were born a year later, you can't. Mm-hmm. And what they're trying, this is an experiment to see if they can eliminate tobacco use in the country altogether by a certain year. So it's a phased approach to that.
Yeah, well, that's wonderful.
Yeah,
that's good.
I think.
Thank you for
trying it.
Yeah.
Well, you know, I know. Thank you for being a small enough country where you can pull off something like this. Now, we hear a whole lot about they've got some totalitarian sort of ideas in those countries too when it comes to their COVID response.
Yeah,
and they just really don't want it there. And so a lot of people have had some things to say about Australia and New Zealand about so this may be people may say the same. I as a libertarian or libertarian light decry any governmental interference when it comes to people's choices that they make. But as a healthcare provider, I would like to see a smoke-free society. No question about that. Now, people that have stock in RJR, you're going to be fine because they figured they saw the writing on the wall a long time ago. I think RJ Reynolds really, it's RJR Nabisco now. What does that mean? Mm-hmm. They've diversified into crackers, things that are not going to be banned. I really think that even maybe 15 years ago, they thought that someone was going to come along and just ban cigarettes altogether, or they were going to lawsuit them out of. You don't hear about those state lawsuits anymore, where they're suing the tobacco companies for billions of dollars.
They do have some, because I know one's going through one right now.
Is that right? Yeah.
Literally right now.
Okay. Well, it was governments were doing it.
Yeah. No, this is individual.
Yeah. Okay. So it's very interesting. And so if you think, oh, well, my stock is going to go down if they ban cigarettes, it won't, because they're just making crackers now. I really think probably tobacco is a fraction of what, I'm just guessing, a fraction of what they actually are in business doing.
I would think so.
Yeah. But anyway.
They're not dummies.
And I don't want to screw up the farmers either, so let them grow pot. Just legalize that.
Yep.
What's wrong with you?
I don't know. People are crazy.
Anyway, I don't know. But, there's oftentimes the healthcare provider part of me struggles with the libertarian part of me. And I'm not 100% sure how to get around that. Because smoking sucks.
Yeah.
I used to smoke. I smoked 3 packs a day.
Yep.
I quit.
Yep.
And it was the greatest thing I ever did. I firmly believe if I didn't quit when I did, I'd be dead right now.
Mm-hmm. How old were you when you quit? Because you weren't smoking when I met you. That's been a long time ago.
I quit in 2000.
Oh, wow. Okay.
Yeah. Now, I didn't smoke all the time.
Mm-hmm.
I smoked from 15 on and off. And then not so much in high school.
Mm-hmm.
And then in college, of course, smoked like a maniac.
Sure.
And then I quit when I saw my first patient in 3rd year of medical school. And then I got into a bad crowd in residency, my 2nd year of residency, and a bad crowd. They're all people you know.
Yes.
Including the attorney that.
Yes, we all know.
Yeah, okay. Anyway, but they all smoked, and I bum a cigarette. Well, just let me bum one. And that is don't ever do that if you're an ex-smoker. Because then I'd bum them, and then I got known as, well, oh, you're going to bum a cigarette? How many cigarettes are you going to bum from us tonight? So then you just go and buy a pack so that they can't shame you because you're bumming anymore.
Mm-hmm.
And then you're a smoker again. Well, you're a smoker the second you pick up that first cigarette that you bummed off of somebody after you've been quit for 4 years, like an idiot.
Yep.
And I was going to bars, drinking, hanging out with loose women.
Oh.
Yeah, I know.
It's terrible.
And there's nothing better. Well, anyway.
Carson, don't listen to this. You're too young.
Yeah.
It's a bad influence.
And talk like it to is it her 11-year-old son that's listening, learning all kinds of good stuff.
So it was, very entertaining, but stupid. And then I smoked again. I smoked more and more and more until I got up to about 3 packs a day. And I said, it wasn't, and I've said this on the show multiple times, it wasn't heart disease or cancer that finally made me quit. It was when I read the statistic that the number one cause of impotence in men over 40 is tobacco abuse, and that was enough. The cancer, no.
Nope.
Heart disease, nope. COPD, nope. That wasn't scary to me. Losing the old machinery, yes, that scared the shit out of me, and that was enough to make me quit.
Didn't know that.
Yeah. Interesting. Well, now you do. So you've learned a thing. All right, here's something about the cupping. So
Hey, everybody at Weird Medicine.
Hey, man.
How's it going?
Yeah, it's going good.
Good. I'm glad everybody's doing so well.
Okay.
Hey, I was just listening to your episode, that segment about cupping after the vaccine.
Right. If he did, well, wait a minute.
Don't they?
If people don't remember, what he's talking about is they did a study that showed that in animals, if you gave the vaccine and then did cupping afterward, which is this thing where you induce a vacuum into a cup and rub it over the skin, and they were increasing the blood flow to the skin and increased the penetrance of that vaccine by almost 100-fold. Well,
So, especially when you're talking stem cells and other injections or medication, don't they factor that in when they talk about the how the strength of the medication or whatever?
Yeah, they do.
Really factor that in. So
yeah, they were just dicking around. I mean, really, they were just seeing, hey, does this do anything?
Mm-hmm.
So, it may increase the efficacy of a vaccine. They don't really know. Or I don't think they know any clinical effects. They just know that it was a 100-fold increase in the number of, was it shit. Hang on a second. We got to look that up again because I can't say that if it wasn't right. Hang on. We're pausing the show right here. Let me see. Cupping and vaccines. Where is that? Okay. Okay, I got it. Okay. And what they found was 24 hours post-injection after they did the cupping, the vacuum on the skin, they showed gene expression after an mRNA vaccine was 8 times deeper under the skin with the rats that underwent the cupping than under those that received DNA or that injections alone. And in this case, it was a DNA. God damn it. Okay, I fucked that up again. I got to get this right because this is
important.
Yeah. And what they found was 24 hours post-injection, they saw that gene expression was detectable 8 times deeper under the skin among the rats that underwent cupping than the ones that didn't. So we don't know if this is clinically relevant or not, but it could be interesting if you've got a vaccine that's hard to get an effect out of, and then you do this, and now maybe you could use a lower dose or whatever. So we'll see. Listen, thanks to Dr. Scott. Thanks, Carson. Don't talk so much next time. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. God damn it. Fuck that up, too. Let me see if I can make that work. Hang on. Yeah, I'm not firing on all cylinders today. Let me see. Shit. Okay,
You're close.
One more time.
You're close, man. It's all good.
I believe.
You're close.
All right, here we go. And what they found was that 24 hours post-injection, they saw gene expression was detectable 8 times deeper under the skin among the rats that had the cupping than the ones that didn't. So there's no clinical benefit to this now, but maybe in the future we could use a lower dose of vaccine and then do this. Would there be a benefit to that? I don't know. Maybe. So we'll find out in the future. This will be pursued. Thanks to Dr. Scott. Thanks to Carson. Don't talk so much next time. Until next time, check your stupid nuts for lumps. Quit smoking. Get off your asses. Get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. There you go.
There you go.
Bastards.
Good job.
All right. Let's see. Yeah, don't applaud. I should have gotten that right the first time I've been doing this 17 years. Hang on. All right, I can live with that. Okie doke. All right, now let's do podcast. Let's take some questions from the crowd because I've got to join all of these fragments from where I started and stopped so many times. And I may have to return some of these phone calls too. So you got anything from in the chat room, Scott?
Nope, no questions.
Nothing?
Nothing.
Okay. Anybody got anything?
But I'll put it out there again.
Okay.
I sure will. I'll put it out there.
Did you see the how the Army came with the that vaccine?
Oh, I meant to mention that. Yeah, let's talk about that and the podcast side.
What was it?
The Army's got a new vaccine that looks really cool. It's multivalent COVID or coronavirus vaccine. I have got to fix that damn camera. I don't know what's wrong with it.
When did you graduate from HV?
What's up?
When did you graduate?
When did I graduate? 2019.
Band, sports, anything?
Not band, not sports, actually.
Yeah.
Not athletic, not musically talented,
Not-
so kind of eliminated.
Are
both
you
the bands.
not?
No, yeah.
Everything in between.
Yeah, no, that's cool. That's cool.
Ugh. I gotta work at the hospital tomorrow. Okay. All right. You ready?
Yeah.
Okay, here we go.
Why does the number 6 want a rematch against 5 and 7? To get even with the odds. Why did the baked potato cross the road? To get to the other chives.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heartbound, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's weird. Wow, it's Weird Medicine. Dad, God damn it. Son of a bitch. All right. Let's see if I can. Yeah. No, does it? Yeah, there's nothing I can do to fix that. I just got to, let me see. I can start from there. Here we go.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got...
Nope. Now, if I'm going to redo it, I'm going to do it right. Okay, here we go.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heartbound, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
We also have Carson, the pre-med student. Hello, Carson.
It's a pleasure. How are you?
Good to have you in here, man. We'll talk to you in a minute. This is a show for people who had never listened to a medical show on the radio or the internet. You got a question you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, pre-med student, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. All right. Well, it only took 14 takes to get here. Thank you for your perseverance. Don't forget stuff.drsteve.com, stuff.drsteve.com for all of your stuff needs. Anytime you're going to go shopping on the internet, go to stuff.drsteve.com. You can click straight through to Amazon, or you can scroll down and see all the stuff that we talk about on this show, including the Navage, the nasal lavage, which is the greatest thing. If you have anyone, and there's still time, anyone on your list that has bad sinuses or chronic allergies, perennial rhinitis, anything like that, a runny nose, they snore, they drive you crazy, get them a Navage, Navage, and you can buy one at CVS. You can go to Navage.com. It is the greatest device I have ever purchased for under $100. And basically, Carson, it shoots saline up one nostril, and it sucks it out the other one. Now, Dr. Scott, you're into traditional Chinese medicine.
Yep.
And I know I've seen this in the Ayurvedic sites, but I've never seen it in a traditional Chinese site where they will take like a rag and they'll stuff it in one nostril and then they'll wend it through till it comes out the other nostril, and then they'll just sort of do this with it. You know?
Yes.
You know what I'm talking about?
Yes. I've seen that after People have been using cocaine for many years.
Oh, well, that's a little different.
Yeah,
They can actually go in just partially and come out the other nostril. But I mean, they go all the way in and then come out. That's not a Chinese tradition?
Not
It's
as
more
I was trained.
I think it was an Ayurvedic tradition. I'm not sure, but I've seen people do it. And I've seen neti pots. You can't look cool doing a neti pot.
No.
Just Google image neti pot, and you'll see a bunch of people looking stupid as shit.
Yep.
But and I can't say you look any more intelligent using the Navage, but you don't look as vulnerable and goofy using it.
Yeah, and it's like kind of a cool looking device.
It is a cool
Yeah,
device.
it's a cool thing.
And they have a 3-tier drying thing now that is really awesome, because back in the day I would just set it all out and let it dry, and then I'd stuff it back in the box. But now they've got this 3-tier thing. It looks like a cruise ship. It does. It's really cool. And but anyway, get them a Navage, but you can get one at stuff.drsteve.com. And tweakedaudio.com, offer code FLUID for 33% off the best earbuds for the price and the best customer service anywhere. I don't even know if we get anything for telling you that anymore. I haven't heard from Tweaked Audio in forever, but it is one of the best places to go, and that's one of the best discounts you can get on the internet. Use offer code FLUID and just watch that $100 go down to $70, or your $30 go down to $20. And simplyherbals.net is Dr. Scott's website. And today, while we were doing the pre-show, I was playing episode number 20 of our podcast, which predates Dr. Scott, predates GVAC. It had double vasectomy Todd. It had Dr. K, the chiropractor who's no longer with us. And it had Jefferson the Shyster on there and P.A. John, and we were talking about the origin of Myrtle, the character, and how I had called Sam Roberts with giving him a happy birthday greeting from an old country woman. Well, I hope you have.
Yeah.
Anyway, and we talked about the origin, and I also talked about my Terminator eyes when I was coming off of Cymbalta. So there's some cool stuff in that episode. I'm going to throw it up on the Patreon. So if you want to hear some old classic bits or hear shows with Tacey and me and some special guests going forward, and Dr. Scott will be in there some too.
Oh, yeah.
Go to patreon.com/weirdmedicine. We've got some very affordable tiers, and you get some cool stuff. And not just audio, there's stickers and there's mugs at different tiers and stuff like that. So check it out at patreon.com/weirdmedicine. All right, now let's go do the end of the show. Let's do another phone call.
Well, I've got a question here.
Okay, good.
Yeah,
good.
Yeah, let's
Okay.
do one from the crew
Well,
here.
hang on. Yeah. Okay, so let me see where we're going to get started here. Okay, that's a good place to start.
Mm-hmm.
Okay.
I've got two for you if you need.
Yeah, okay.
Yep.
Well, okay, so let's take a couple of questions before we get out of here. What do you got, Scott?
How about Not Cupcakes? She's asking if we've seen the Lenox Hill documentary series on Netflix where they're talking about the cancer treatment. We've already got one shaking his head positive. Cancer treatment that gets through the blood-brain barrier, and how is that study coming? Have you seen it?
I have seen Lenox Hill.
Good.
It was fantastic.
So what are we talking about?
Yeah, can you wax poetic on it for us?
Yeah,
I've
sure.
not seen it.
So it follows a team of neurosurgeons, actually, as well as, I think it's an OB and maybe an EM.
Okay.
And throughout the COVID pandemic as well in the last couple of episodes. But yeah, it's really cool. It's on Netflix. I loved it.
Okay, so good. You loved it, but what about this blood-brain barrier business?
I have no clue about that. I watched it a year ago, but I mean, it was fantastic.
I'm looking at a thing on PubMed. This is from 2020. Super selective intra-arterial cerebral infusion of modern chemotherapeutics after blood-brain barrier disruption, where we are now and where we are going. anybody can go to PubMed and look this up if there's something interesting. They're basically saying that delivery may significantly affect the way treatments are delivered to patients with brain tumors, in particular glioblastoma multiforme, which sucks.
It really fucking sucks.
I hate that GD tumor, and they were using, okay, here we go, bevacizumab. Oh, I said that one okay.
You should have asked me to say
that's
it.
a monoclonal.
So you can have it pronounced correctly.
That's another monoclonal antibody. And they have trouble with these things because there is this blood-brain barrier that keeps things from getting across that blood-brain barrier for a good reason. You don't want toxins in your bloodstream to get across into your central nervous system. And so there are certain things that just can't cross it. And monoclonal antibodies are one of them. The immune system has a hard time getting into the blood-brain, getting across the blood-brain barrier. So they're saying that this, with refinement and standardization of the techniques, improved drug selection and formulations, development of methods to minimize treatment-related neurologic injury, this therapy may offer significant benefits for the treatment of brain tumors. So yeah, it looks like it's still ongoing. We're not doing it regularly yet in the cancer centers that I'm aware of. Maybe they are doing clinical trials.
Okay.
If you have someone that's interested in trying this, go to clinicaltrials.gov and just put in glioblastoma multiforme, and then what you're going to look for is selective intra-arterial cerebral infusion.
Right on.
And you may be able to find studies that encompass that. So yeah, very interesting.
Yeah, that's good.
I'm assuming that's what she's talking
Yeah,
about.
and I'll check it out. We've got a couple days off. Hey, last quickie, and this is Dr. Steve's wheelhouse here. This is from Sean. I've got a friend who's been suffering from severe depression, and they're going for ketamine treatments. He was just wondering a little bit about ketamine treatments. And
ketamine's awesome. It's an alternative to electroconvulsive therapy in people who have just refractory depression that's affecting their ability to function. And right now it's very expensive. The crazy thing is that I can order ketamine suppositories for someone with rectal cancer and rectal pain, and it might cost them $10, whereas the ketamine nasal spray for depression is like $1,400 a dose.
Sakes.
Yeah, it's crazy.
That's not cool.
So, but that's because it just came out. They're not experimenting. Well, they are still experimenting with it, but it's unfamiliar to most clinicians, and you have to have a risk evaluation and management sort of license to do it. And so there's very few places, relatively speaking, that are doing it still. But it's very effective, whereas a drug like, God dang it. Hang on. E-Rock, you're on Weird Medicine. Oh, God.
Oh.
What the hell is that?
Uh-oh.
He butt dialed you.
Yeah, yeah, he did, didn't he? Yep, that's exactly what happened. Oh, well, I was getting excited. Whereas a drug like Prozac, which is a selective serotonin reuptake inhibitor, could take up to 8 to 12 weeks to work, ketamine can work within days. So I'm looking forward to using it particularly in my population, hospice and palliative medicine people. They don't have 8 to 12 weeks to wait for their depression to resolve. So you want to have a preparation that will improve their quality of life and their mentation and their mood very quickly, and ketamine is one of those. So I'm looking forward to, in the future, seeing that used more frequently. But it's a dissociative anesthetic, and what they found in very low doses, it can be helpful in depression and also in neuropathic pain and all kinds of different kinds of pain. So when I have a suppository for someone with a rectal cancer that's very painful, and it's not effective, just the lidocaine alone, just numbing medication, we'll throw a little ketamine in there, and you do it at low enough dose so they don't get systemic absorption of it, and they're not like seeing diamonds in the sky and stuff like that. But it's very, very effective. So it's great medication. I'm looking forward to seeing more of it used in the clinical setting. On that same subject, I'm looking forward to psilocybin being used in clinical research. The data is all there that it is effective in a bunch of different syndromes, including depression. And I've got a friend that microdoses, is self-medicating herself. Self-medicating herself. Could I be more redundant when I talk? But she is self-medicating with low-dose magic mushrooms and says it's changed her life.
Yeah. I've heard that a number of
I
times.
I can't recommend that.
No, I'm not either, but I know for a fact that.
Yeah, I can't. Okay, again, we're not recommending that you try that. I'm just saying I know this is anecdotal, one person that's doing it, but there is data out there, and we will be using the sort of psychedelic medications in very low doses for these drugs going forward, I believe. I believe that they've got enough data that someone will apply for FDA approval for some version of those drugs, and we'll have some great success with it. All right? Got anything else?
I think I'll do it.
Okay. Listen. Yeah, go ahead.
No, just everybody have a wonderful holiday.
Yeah, that's right. This is actually coming out Christmas Day. So for those that celebrate Christmas, Merry Christmas. For those that don't, oh, shit.
Happy Saturday.
Let me try that again. Let me set that one up again. For those that celebrate Christmas, have a great holiday and Merry Christmas. For those who don't,
You get nothing. You lose. Good day, sir.
boo on me for effing that up. So
I am the smart.
I've used those two drops too many times today.
Well, that's because you're an idiot.
So, all right, we can't forget Rob Sprance, Bob Kelly, Greg Hughes. Can't forget Dr. Scott. Thanks for coming, Carson.
It's a pleasure.
And don't talk so much next time.
Never.
Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, and the Florida Floozy. And by the way, all three of those are the same person. She called me and she said, "No, who's the Florida Floozy?" It's like you idiot. Who do you think it is? Okay, Roland Campos, sister of Chris Sam Roberts, she who owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double, Steve Tucci, the great Rob Bartlett, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, Jen Santoro, the inimitable Vincent Paulino, everyone. Eric Zane, Bernie and Sid, Martha from Arkansas's daughter, Ron Bennington, and of course our dear departed friend, Fez Watley, who supported the show, has never gone unappreciated. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners, whose voicemail and topic ideas make this job very easy. Now I'm going to go into FM mode. Go to our website at drsteve.com for schedules and podcasts and other crap. That's how I used to talk when I was on WXYC at Chapel Hill. And I had a girlfriend. Well, she wasn't a girlfriend, but I wanted her to be. And apparently she wanted to be too, but we were still at that stage where you didn't talk with each other. And she said, "Why do you hype your voice like that?" And I got all offended because I was way more narcissistic back then than I am now. And then she just walked out, and that was the end of that. But it could have been something I heard later. Go to our website, and Jody Dehoney, if you're still out there, I'm sorry. And I was extremely interested, and I was just too stupid. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right, thanks, everybody. All right, there you go. That's it.
Beautiful.
Yeah, beautiful. Yeah, that's not the word I'd use for it. Let me see. Did I have to stop that time? No. Okay, so we're good. All right. I'm going to look at the chat room myself. See if we've got anything I need to deal with. Where did it? I don't even know where it went.
No, they're still there.
I know they are. I can't find the window.
Oh, sorry.
No, I'm a fucking idiot.
I'm the spot one. SAMRT.
SMRT. Let me see. Oh, because I am an idiot. Okay, there you go. Jeff Landro, yes, or Landrano. I'm assuming that you're from Louisiana. Could be wrong. But Jeff, yes, I see it as the beginning of the end, if not the end. He's asking, is the Pfizer Paxlovid the end? And we've been saying this for the longest time. And if you go back and look at my COVID updates from the very beginning of the pandemic, I used to do them every week, and I just gave up because it was like, this fucking thing's never going to be over. Yeah. I said if we had a therapeutic that would keep people out of the hospital and we could treat them early, that'd be the end of it. It'd be over. Yeah. And so I'm sticking by that. 90%'s a big deal. If we can get this down, if Omicron, again, is not as virulent or lethal as Delta and the previous, Alpha and all those, and we have a pill that keeps people out of the hospital 90% of the time, yeah, we can go back to normal, because there will still be people who get sick and go to the hospital. There will still be some that die, but we'll be getting them down to pre-COVID levels of coronavirus deaths. Because if you think people didn't die of coronaviruses before the pandemic, you are mistaken. We just didn't test for it, because there are 10,000, 20,000 people a year. We would just say they had viral pneumonia and they would die from it, and we didn't test them for coronavirus. Well, now, we're going to test everybody going forward for coronavirus. So, yeah. Thank you, Sean. Sean is, and the good news is we have it documented, because I have really been saying it from the beginning, because it's true, and it pisses me off. And I said I was going to go ham this episode, and I forgot. And so next episode we got to go ham. That the fact that we have put all of our eggs in the vaccine basket and in treating people with severe illness rather than trying to prevent people from progressing to severe illness pisses me the fuck off. So anyway, what are we going to do? No. That wasn't the girl. Okay, not Cupcake's ass. Wasn't she the girl who took a dump before you ate, before you went to the Y? No. That was a different person. What was I just talking about? Oh, Jody. No. The woman in the studio. That was in college. This other person who took the dump and then came back in the room and said, "Okay, proceed," was during residency.
Tacky. Very tacky.
Well, it was. That was very tacky. And you get down there and you get that waft, and it's like, that's fresh shit smell. That's not good. Ladies, don't do that.
Don't do that.
Don't do that to your fellers. Okay, let's go over the stories that we did so that I can get them off of here. We did white spots on nails, unexpected weight loss, props from the Bat Cole Foundation. We did not do the pneumonia vaccine. Perimenopause, we didn't do FDA versus CDC. Dr. Scott's a moron, we did that. Cupping and vaccines. Melanopostitis, we did. Did we do milking the prostate?
Not, we did the previous show.
We did that
last,
one.
but not this one yet.
Okay. Yep, I'm here for one of Dr. Bird's internal treatments. Crepitance of the spine. Did we ever do that? That was one for you.
No, we haven't. No.
Okay, we need
save it for next time.
We'll do that next time. Okay, I'm just cleaning up this list. Okay, and I've got some I got to do on Patreon too. The Patreon's doing good. We've got some really good stuff on there. People need to check it out if they like this at all. All right, thanks everybody. We're going to shut it down. Thank you, and we'll see you next week for the next edition of Weird Medicine.
You got time to play one, or you?
Oh yeah, you want to play one?
Yeah,
oh hell yeah! Never
play
mind. All right.
I don't know what.
Okay. Yeah, we can play one. Shit, I didn't even think of that. Not that anybody's going to stick around for that.
No, let's hope not. Let's hope they've turned it off at this point. Let's hope so. If I can keep that E string in, well, it's still in from last week. That's a good sign.
You want to do that one?
Not in that key.
Okay.
Money.
So, I've been saying this for the longest time. I need to bring one of my drum machines in here and hook it up so that we've got it, so we can at least have a rhythm section other than just my bass.
Yeah, but then that'll require somebody can drum.
You know what that is? Atomic bomb. Why is that so out of tune?
I don't know if that's a...
Is that the A string?
Yeah, it's an A. Give me an A, will you? It may be my tuner. Give me an A.
I have the robot tuner. Use the robot tuner. Here. Hey, anybody that's listening, if you got anybody that is... Here you go.
That's neat.
Here.
Yeah, thank you.
That is a stringed instrument person. Check out.
Thank you. Hey, yes, thank you.
Dr. Scott tuning this sucker up.
There we go. There we go. Thank you. I'm just going to go ahead.
Yeah, just turn the whole thing
Yeah,
up.
while I'm here. Flat. Sure. Pretty close. Well, that's got to be close there. Let's see. Yeah, I don't know. My tuner was doing. I don't know if it's picking up something else.
All right, what are we going to play? You have to go?
Oh, no.
Okay.
You probably should.
No, I'm excited.
If you know what's good for you. You know LA Freeway? It's the old Jerry Jeff Walker, GCD, baby.
Okay.
I believe you
If
can.
that's all it is.
Figure it
But
out.
you always say that. And then there's a fucking A flat and a
F sharp minor and oh wait, there's an A minor in there.
You
eventually.
son of a bitch. Is there really?
Yeah, but you'll figure it out.
Okay. I got
Back
the
to-
music, by the way, to Shmoyoho's Oh My Goodness, Oh My Damn. Do you know that song? Okay. Hang on. Oh, and you know what else is a good one of theirs? And we'd have to have a girl to do it. Is I Love Cats. Have you heard that one? So what they do is they get these YouTube people. Let me see. Ah, shit. Hang on. Oh. Hang on. Hello.
All right.
Hey, are you there? Hey, we're doing our show. Can I call you back?
I want to sing on it.
Oh, you can sing.
Hey, doesn't he have an ambulance to be chasing somewhere?
We're getting ready to do us a hoot now.
Hey, I hear an ambulance going down the street. He could go check it out.
All right, I will. Bye. Jesus. Let me see. It's called I Love Every Kind of Cat or something like that.
Oh God.
Hang on.
Well, that's an immediately that's a deal breaker right there, isn't it? Hey, I got a great new song. It's called I Love Cats.
So this was her original.
Debbie. This is my first attempt. At
No, she was doing a goof, but
eHarmony video. This is my first time at online dating, so I'm nervous, but I'm excited at the same time. So I'm just gonna start talking about what I like and hope I get some replies. So I am a recent MBA grad from Villanova.
So they took this,
okay,
right, and this is what they turned it into because they did auto tuning. And I think this is brilliant. And this is old. This is 10 years ago, but this guy who did this stuff is just a brilliant songwriter because these are really catchy tunes. These have stayed in my head for. This is some of the best stuff that was ever done on the early sort of.
Worse than me singing.
No, it's great. She was speaking and they turned it into a song.
Magic, all I can say is magic.
Have you heard the one they did about the guy doing the Five Guys review?
Oh yes,
No, I haven't.
Oh my goodness, oh my damn, oh my goodness, they're going ham. Oh my goodness, oh my damn, oh my goodness, they're going ham. This is how bacon is supposed to be. The fries, they blend so perfectly. The cheese up in here is going ham. Damn, damn, damn.
Now that's brilliant.
That's brilliant.
That's okay. Anyway, all right. What were we looking for?
N G.
Okay.
G C D. There may be an A minor in the chorus.
All right.
You'll figure it out.
Will I though?
Yeah, yeah. Back up all your dishes. Make note of all good wishes. Say goodbye to the landlord for me. Son of a bitch, he's always bored me. Throw out those old LA papers. Molded box of vanilla wafers. Adios to all this concrete. Gonna get me some dirt road back street. We're going to the sea. Going to see if I can just get off of that LA freeway without getting killed or caught. Down the road, E minor in the clouds.
You motherfucker. Oh, it's just GCD.
Hey, Bob, if I could just get off of that LA freeway without getting killed or caught.
What is that?
That's just a G. That's just the finishing that.
Let's do that. Okay, let's.
So
let's do this.
E minor.
G. No,
Yeah, G,
so it
G,
goes
G,
D,
G,
C,
yeah, G to a G.
C, C, C,
Yep.
D, D,
Yeah.
D, G,
Yep.
G, G, A, right?
Yeah, A minor. Yeah. And resolves
And
to
what?
D.
It doesn't resolve to the D, but it goes to the D.
It resolves. That's for.
It'll resolve to the G eventually.
And now we're going to go back to the G for the starting.
Where does it go to the E minor?
It's in the interlude, so it's a G. Yep, G. E minor. A minor. D. And then it wraps it back to the G.
Well, now where does it do that?
It's
then?
just-
That's a complete. Okay, let's do that whole chorus.
Yeah, it's just that interlude. Let's go back to the it's the one. Hell, I'd send it to the email, but you wouldn't fucking read it.
Yeah, I would.
Yeah, let's go back to the. We'll go back to the.
Let's start the chorus.
Yeah, start the chorus.
So
C. If I can just get off of that D freeway with that C, G, C.
Wait.
G down the road in an E minor to an A minor.
Oh, okay.
I, D, bop, bop. If I can C, get off of that D, LA freeway, G without getting killed or C called. Now it just goes through the G, E minor, A minor, D.
So it does it twice?
No,
does the whole chorus twice?
No, it just does the whole chorus one time. And that little interlude is just to bring you back to the.
It only does that once.
Yeah, just one. Yeah, yep.
Okay.
Yeah, just that one time.
A turnaround.
And
All right.
yeah, it's turnaround. It's interlude. Yep.
All right, all right.
And then you're back to the G.
Okay.
Here's to you, old skinny Dennis. Only one I think I will miss. I can hear that old mesa singing, sweet and low like the gift you're bringing. Play it for me one more time now. Gotta give it all we can now. I believe every word you're saying. Gotta keep on playing. If I can just get off of that LA freeway without getting killed or caught. Down the road to an E minor, a cloud of smoke to an A minor, to the land that I deep bought. If I can just get off.
Does do it twice, you motherfucker.
There's only once.
Hang on, Stacy's calling.
Oh.
Son of a bitch. Hello.
Technically, it's twice.
Hello.
Hey, they're here.
Okay.
They couldn't wait till
Okay, we're coming down. Okay.
Okay.
All right. Love you. Bye. Ah, shit. We gotta go.
Yeah,
I do want to play that.
That's
song.
a great
That's
tune.
a good song.
You've got that deep. You've got that bass walking down. It's perfect, Steve. When you just lead right back into the
exactly rocket science.
Fabulous, baby. Well, Carson, you have just experienced exactly what not to do
Oh,
on a
that's,
radio show.
Certainly a lot better than I could do.
Shit.
All right, guys.
All right, everybody.
Thanks.
See
Take
ya.
care.
Thanks. Bye. God damn.
Uh-oh.
Terrible.
That was a great tune.